The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, with another edition of The Genuine Article. And today I'm talking to Dr. Cecilia Lindy. Dr. Lindy is the chief of cardiology at the Karolinska University Hospital, and she's about to publish a really important article in JACC presenting the long-term results of the REVERSE trial. The REVERSE trial was a study that looked at the role of cardiac resynchronization therapy in heart failure patients who were asymptomatic or minimally symptomatic. I wonder, Dr. Lindy, can you review the general aspects of the REVERSE trial for us?
Yes. We demonstrated a beneficial effect of CRT already in mild heart failure, function class 1 and 2, in patients with broad QRS and poor left ventricular function. And what we showed was a significant reverse remodeling over time, at least over 24 months. And that was linked to a reduced need to be hospitalized for heart failure. And this may mean that a CRT introduced early on in mild heart failure may actually prevent disease progression. The recently made CRT data indicate that this is so. And of course, we are very thrilled about this.
Sure. Well, CRT is of unquestioned value in patients who meet the standard criteria of class 3 heart failure or widened QRS complex, ejection fraction below 35%. But now you're extending the application of CRT into a group of patients essentially who are asymptomatic with left ventricular dysfunction. Is that correct?
That is correct, but with the important restriction that it applies to patients who are previously symptomatic, ACC, AHA, stage C. So it's not just any patient with a structural heart disease who never had any symptoms. It's those with previous symptoms.
Now, in the REVERSE trial, were you able to show a benefit for mortality as well as remodeling? No,
we did not. And in my mind, there was a trend to an improvement in mortality over the 24-month results. But in my mind, it may well be that if the observation time would have been longer, that we might have been able to show something. And the same observation was made at CRT with a 2.4-month median follow-up time. So I think that the observation time in these mildly symptomatic patients probably needs to be more in terms of several years, 4 years or so, to be able to show benefit in mortality.
So, based upon these results of the REVERSE trial, in your own practice, are you now applying resynchronization therapy in these minimally symptomatic or asymptomatic patients with left ventricular dysfunction?
Well, yes, if they indicated for an ICD, which most of the patients are, but for primary preventive reasons.
Well, very good. I believe what we're seeing now is an expansion of the role of CRT in our heart failure patients, and the REVERSE trial is certainly an important part of the evidence that supports this expansion. Thanks very much for being with us, Dr. Lindy. For the Genuine Article, I'm Tony DeMaria.